There's a criteria that is used to classifying thyroid orbitopathy. Now, I think first of all, let's remind ourselves what thyroid orbitopathy is. Thyroid orbitopathy is simply what, like, there's too much thyroid hormone levels in the body. So it is now affecting your eyes. It is making your eyes to now purge out. Okay? So you can actually classify this disease condition under a criteria known as what NOSPECS. Okay, so that's what we'll just be looking at. This is another picture, or you could say this is thyroid disease, thyroid eye disease. It's any disease condition of the eye that is caused by what? Thyroid. Okay, so let's look at the classification before we remind ourselves about the types of thyroid orbitopathies. So the NOSPECS is actually a criteria that classifies what? Thyroid orbitopathy from 0 to 6. Now 0 to 6 with 0 inclusive, that means what? There are 7 classes, right? Now the N in no spec stands for what? There are no symptoms or signs. Okay? O stands for what? Only signs, no symptoms such as what? Okay, no symptoms, right? And the signs are limited to things like what? Lid retraction, where your lids are lagging behind, so the white part of your eyes is now showing too much. It could be lagging of the lid, or it could be stare. That means instead the person's eyes like pushed out to the level that sometimes they might sleep and their eye is still widely open. Okay. The S is what? There's a soft tissue involvement. P is what? Proptosis. Okay. E is what? Extraocular muscle involvement. So it's now going to involve all those lateral rectus, medial rectus, superior oblique, inferior oblique, and all that. Okay. Then C is what? Corneal involvement. S is what? Sight loss. That means what? The ophthalmic nerve is now what? Involved. I know the ophthalmic nerve is what controls all those sights and all that. Okay. So NOSPECS classification is not universally acceptable, but it's quite nice. So detailed classification by the European Group of Graves Orbitopathy incorporates clinical activity score and severity score. So that one too, we'll still be looking at it specially. Okay, European Group on Graves Orbitopathy classification. All right, so that's it for the NOSPECS.